Hello, my name is Jake Greenspan, and I'm the co-director and co-founder of the Floortime Center, along with Tim Bleeker. Back in 2004, when we started the Floortime Center, we were getting support from my father, Dr. Stanley Greenspan. He trained us in the Greenspan DR model and the Greenspan Floortime approach. And in doing this, he imparted one main piece of wisdom that he told us would carry us through any challenging moments. He said that no matter what decision you have to make, as long as you make it with the child's best interests in mind, you will always achieve success. Even if in the short run it may be a challenge to implement some of these changes, nonetheless, in the long run, you will always achieve success if you have the child's best interests in mind. And to this day, every challenging moment, every decision we've had to make is based on this one piece of wisdom he imparted. But what this means from a practical standpoint is we have spent time and money developing a very specific office environment for the various children we work with. Every child can have their own space. We have dozens of therapy rooms between our two locations, and each room is curated to support a child's different physical and emotional needs. There are bigger rooms and smaller rooms, different equipment, different types of play opportunities, etc. In addition, we also spend a lot of time and energy training and overseeing our staff's implementation of Dr. Greenspan's work. We make sure consistently that they are integrating his philosophy and his techniques into their individual practices. This means that there's ongoing oversight and support from us, the directors, within every child's program at the Floortime Center. One of the leading developmental psychologists in the DC metro area often sends us families, and he tells them before they get to us one important thing. He says, Floortime works if you do it. And this is very important because it does work if you do it, but what it really means is that parents are an essential part of a child's program. The developmental community has known this for many, many years, and there's many research studies that show the importance of child-caregiver interactions and for children with developmental challenges, the importance of what we call a parent-centered approach. This means that parents are an important part, but not the only part. We need to make sure that parents feel supported and educated in how to implement these strategies at home, and that is one of the main roles of myself and Tim Bleeker, the other director. We are parent educators, and we will always be there to support parents and oversee programs. But in doing this, we do set expectations for parents. We make sure that the parents and the families and caregivers we work with understand their role. This means that a minimum of 30 minutes a day with each caregiver, a child needs to be spending doing one-on-one, open-ended, unstructured activities where the child is the leader. The parent is joining the child, not teaching the child, not directing the child, not getting the child to do the things they want, but instead doing the things the child wants. When families are able to achieve this consistently, we see the type of results that my father was able to achieve when he was alive and practicing. He was able to help some children become what he called superstars, move past their diagnosis, move past the expectations that may have been limiting them from their diagnosis. Now, I'm not saying we can achieve that with every child, but we've achieved that with more children than many of the standardized programs offer. This also means, though, not only do we want to make sure parents are integrating these Greenspan Floortime principles into the play with their child, but it's also essential that parents integrate these same principles into daily activities, daily routines. If a child is struggling transitioning from home into the car or out of the car into another place, it's important that we don't just grab them and pull them kicking and screaming, but instead we support them and nurture them while also setting limits and boundaries. Unfortunately, many children are pulled between many types of philosophies and interventions, and that creates confusion for them when they're not actually understanding how they are able to participate in the world around them. Sometimes it's very dogmatic, rigid, and a directive. Sometimes it's more open-ended and child-centered. At the Floortime Center, we want parents to understand that these principles that Dr. Greenspan wrote about in his 40 books are relevant for almost all situations. Unfortunately, some people think that Floortime is just for play and social skills. It's actually an intervention that supports and encourages overall social emotional health, especially when it's used all the time. At the Floortime Center, we pride ourselves on communication. We give parents a lot of feedback, suggestions, and recommendations, and we expect the same in return. While we understand that lives are busy and there are a lot of expectations and requirements that we all have to get through in our daily lives, We encourage and expect parents to share with us the important changes that are happening in their lives and especially in their child's lives. This means changes at home, changes at school, changes with the therapeutic program, as well as any other things that may be relevant or we might not even realize are relevant. Sometimes little changes in a child's life can have big repercussions. It's important for us to know that in order to implement the most effective programs and support the child as they're going through those changes. We don't want to be challenging more during times of other changes, so it's important we get that information. In order to do that, we expect parents to respond to our emails within 24 to 48 hours to give us the feedback that we're looking for in order to provide the most effective programs. We will often ask questions in the emails we write. Sometimes we will send forms to gather that information. But regardless of the format, it's important that we get responses in order to make sure we can implement the most effective program and so our staff really feel that they are part of a team that is operating at home as well. At the Floortime Center, we believe in a comprehensive program. This is different than just occupational therapy and speech language pathology services. Many clinics, if not most clinics, are service providers. This means they provide a variety of services, and each of those services is provided independently by the professional. Unfortunately, rarely are these services integrated under one philosophical model, which means we may have one therapist who's more play-based, one who's a little bit more directive and rigid. Or we may have one therapist who's very positive and warm and nurturing, and another therapist who's a little more emotionally shut off. At the Floortime Center, we believe that a comprehensive program means that all children receiving services need to be being supported in the same way. What this means for us practically is that every intervention we offer, whether it be speech and language pathology, occupational therapy, social groups, vision therapy, pure floor time, parent coaching, etc., each of these interventions maintains the fundamental principles that children need to be able to relate, communicate, and think in order to achieve success. That means if we don't have a meaningful, positive relationship with a child, we have to build one. If we have one, sometimes we need to deepen it. In addition, it's important that every intervention works on communication because every child needs to interact and communicate with the world around them. This means even our occupational therapists and vision therapists, and even during feeding therapy, we are working on communication and the child's ability to do so within that curriculum. If we only work on communication within a speech session, unfortunately, the child is learning a splinter skill. However, if we work on communication all the time, now they're generalizing those concepts. In addition to relating and communicating, every intervention allows the child to do the thinking. This means we are not trying to force them to exhibit a specific behavior, outcome, or even just say a certain word. When we tell a child what to do, when we show a child what to do, we are doing the hardest part for them. We're essentially teaching the test. Many interventions do this because it's an effective way of achieving their goals and crossing them off a list. Unfortunately, that has been proven to be ineffective for long-term growth. So at the Floortime Center, we make sure every child is given the opportunity to relate, communicate, and think. We hope that by working with us, that it will empower you to advocate for your child, and not only advocate for them, but to feel in control of their program and their developmental progress. One of Dr. Stanley Greenspan's dreams was to help parents feel that sense of empowerment and control in such a chaotic world, especially when receiving a diagnosis like autism or many other developmental delays.